An overview of anatomy and physiology of the human body. In this section, the entire body will be studied. The various body systems, organs, tissues, and positional and directional terms will be addressed. Organs. Organs are comprised of several types of tissue. The stomach is made up of muscle tissue, nerve tissue, and epithelial tissue. The medical term for internal organs is viscera. Systems are groups of organs working together to perform complex functions. Body systems. Musculoskeletal, functions, support, movement. Protection. Organs, muscles, bones, joints, bone marrow. Body systems. Integumentary. Functions, protection, organs, skin, hair, nails. Body systems. Gastrointestinal, functions, nutrition, organs, stomach, intestines. Body systems. Urinary, functions, elimination of nitrogenous waste, organs, kidneys, bladder, ureters, urethra. Body systems. Reproductive, functions, reproduction, organs, ovaries, testes. Body systems. Blood/lymphatic, immune, functions, transportation, protection, organs, blood cells. Body systems. Cardiovascular, functions, transportation, organs, lymph glands, heart, vessels. Body systems. Respiratory, functions, delivers oxygen to cells, removes carbon dioxide, organs, lungs, bronchi, trachea. Body systems. Nervous/behavioral. Functions, receive/process information, organs, brain, nerves, mind. Body systems. Endocrine. Functions, effects changes through organs, pancreas, thyroid. Body cavities. The body is divided into 5 cavities. 2 of these cavities are in the back of the body and are called dorsal cavities. The positional term is posterior. The other 3 cavities are in the front of the body and are called ventral cavities. The positional term is called anterior. The cranial 25 cavity and the spinal cavity are the 2 dorsal cavities. The ventral cavities are the thoracic cavity, which is divided into 2 smaller cavities, the pleural and the mediastinum. The pleural cavity is the space surrounding each lung, and the mediastinum contains the heart, aorta, trachea, etc. The diaphragm, a muscle, separates the thoracic cavity from the abdominal cavity. The abdominal cavity contains the stomach, the small and large intestines, spleen, pancreas, liver and gallbladder. The pelvic cavity contains the rectum, urinary bladder, urethra and ureters, uterus and vagina in the female. Due to the fact that there is nothing that separates the abdominal cavity and the pelvic cavity, they are often referred to as the abdominopelvic cavity. Planes of the body. Dividing the body into planes or flat surfaces is an additional way to describe the body. These descriptions listed below are useful when doing magnetic imaging, CT scans, and other imaging techniques. Sagittal planes are vertical planes that separate the sides from each other. Mid-sagittal plane separates the body into right and left halves. The frontal plane divides the body into front and back portions. The transverse plane divides the body horizontally into an upper and lower part. Positional and directional terms: anterior, ventral, front surface of the body, posterior, dorsal, back side of the body, deep, away from the surface, proximal near the point of attachment to the trunk or near the beginning of a structure, distal, far from the point of attachment to the trunk or far from the beginning of the structure, inferior, below another structure, superior, above another structure, medial, pertaining to the middle or nearer the medial plane of the body, lateral, pertaining to the side, supine, lying on the back, prone, lying on the belly. Musculoskeletal system. The musculoskeletal system includes the bones, muscles, and joints. The bones are connected to one another by fiber bands of tissue called ligaments. Muscles are attached to the bone by tendons. The fibrous covering of the muscles is called the fascia, and the articular cartilage covers the end of many bones and serves as a protective function. The musculoskeletal system acts as a framework for the organs, protects many of those organs, and also provides the organism the ability to move. Bones. Bones are complete organs made up of connective tissue called osseous. The inner core of bones is comprised of hematopoietic tissue. This is where the red bone marrow manufactures blood cells. Other parts of the bone are storage areas for minerals necessary for growth. Examples of these minerals are calcium and phosphorus. Types of bones. Bones are categorized as belonging to either the axial skeleton or the appendicular skeleton. The axial skeleton consists of the skull, ribcage, and spine. The appendicular skeleton is made up of the shoulder, collar, pelvic and arms and legs. Bones come in a variety of shapes and sizes. The following is a description of shapes of human bones and where they are located. Long bones are typically very strong, are broad at the ends and have large surfaces for muscle attachment. The humerus and the femur are large bones. Short bones are small with irregular shapes. They are found in the wrist and ankle. Flat bones are found covering soft body parts. These are the shoulder blades, ribs, and pelvic bones. Sesamoid bones are small, rounded bones that resemble a sesame seed. They are found near joints and increase the efficiency of muscles near a joint. An example of sesamoid bone is the patella. Bone landmarks: crest ridge of bone, spine sharp, narrow projection, condyle knuckle-shaped portion of bone, process projection of bone, tubercle small, rounded projection, tuberosity of projection, foramen a rounded orifice in the bone, sinus cavity inside of bone, sulcus a groove in the bone. Joints: synarthrosis an immovable joint, amphiarthrosis a slightly movable joint, diathrosis a freely movable joint. The axial skeleton: skull, spine, ribcage. The skull is made up of two parts, the cranium and the facial bones. The cranium includes the following bones: frontal bone, forms the anterior part of the skull and the forehead; parietal bones, forms the sides of the cranium; occipital bone, forms the back of the skull. There is a large hole at the ventral surface, in this bone, called the foramen magnum, which allows the brain communication with the spinal cord. Temporal bone, forms the two lower sides of the cranium; ethmoid bone, forms the roof of the nasal cavity; sphenoid bones, anterior to the temporal bones. Facial bones: zygoma, cheekbone; lacrimal bones, paired bones at the corner of each eye that cradle the tear ducts; maxilla, upper jaw bone; mandible, lower jaw bone; vomer, bone that forms posterior/inferior part of the nasal septal wall between the nostrils; palatine bones, make up part of the roof of the mouth; inferior nasal conchae, make up part of the interior of the nose. Spinal/vertebral column. The spinal/vertebral column is divided into 5 regions from the neck to the tailbone. There are 26 bones in the spine and they are referred to as the vertebrae. The following list explains the bones of the spine. Cervical neck bones: thoracic, upper back; lumbar lower back; sacral, sacrum; coccygeal, coccyx, tailbone. Ribcage: there are 12 pairs of ribs. The first 7 pairs join the sternum anteriorly through cartilaginous attachments called costal cartilages. The true ribs, numbers 1 to 7, attach directly to the sternum in the front of the body. False ribs, numbers 8 to 10, are attached to the sternum by cartilage. Ribs 11 and 12 are floating ribs, because they are not attached at all. The appendicular skeleton. The upper appendicular skeleton includes the shoulder girdle, which is made up of the scapula, clavicle and upper extremities. The scapula, or shoulder blades, are flat bones that help support the arms. The clavicle, or collarbone, is curved horizontal bones that attach to the upper sternum at one end. These bones help stabilize the shoulder. The upper extremities consist of the following: the humerus, which is the upper arm bone. The ulna is the lower medial arm bone. The radius is the lateral lower arm bone, in line with the thumb. The carpals are wrist bones. There are 2 rows of 4 bones in the wrist. The metacarpals are the 5 radiating bones in the fingers. These are the bones in the palm of the hand. The phalanges, phalanx.s, are the finger bones. Each finger has 3 phalanges, except for the thumb. The 3 phalanges are the proximal, middle and a distal phalanx. The thumb has a proximal and distal. Lower appendicular. The lower half of the appendicular skeleton can be divided into the pelvis and the lower extremities. Pelvis, superior and widest bone; ischium, lower portion of the pelvic bone; pubic bone, the lower anterior part of the bone. Lower extremities: femur, thigh bone, patella, kneecap, tibia, shin, fibula, smaller, lateral leg bone, malleolus, ankle, tarsal, hind foot bone, metatarsal, midfoot bone, phalanx, toe bones, 14 in all, 2 in the great toe, 3 in each of the other toes. Fractures. A fracture is a broken bone. Most fractures occur as a result of trauma, however some diseases like cancer or osteoporosis can also cause spontaneous fractures. Fractures can be classified as simple or compound. Simple fractures do not rupture the skin, as compound fractures split open the skin, allowing for an infection to occur. Compound fractures are considered an emergent situation. Types of fractures: comminuted, the bone is crushed and or shattered. Compression, the fractured area of bone collapses on itself. Callus, The break of the distal end of the radius at the epiphysis often occurs when the patient has attempted to break his or her fall. Complicated, the bone is broken and pierces an internal organ impacted, the bone is broken and the ends are driven into each other. Hairline, a minor fracture appears as a thin line on X-ray and may not extend completely through the bone. Greenstick, the bone is partially bent and partially broken, this is a common fracture in children because their bones are still soft. Pathologic, any fracture occurring spontaneously as a result of disease. Salter-Harris, a fracture of the epiphyseal plate in children. Muscles, muscle is tissue composed of cells. Muscles have the ability to contract and relax. The muscles in the human body have three different functions: 1. To allow the skeleton to move, 2. Responsible for movement of organs, and 3. To pump blood to the circulatory system. Muscles are attached to bones by strong, fibrous bands of connective tissue called tendons. Muscle actions, action extension. Description, to increase the angle of a joint. Action flexion. Description, to decrease the angle of a joint. Action abduction. Description, movement away from the midline. Action adduction. Description, movement towards the midline. Action supination. Description, turning the palm or foot upward. Action pronation. Description, turning the palm or foot downward. Action dorsiflexion. Description, raising the foot, pulling the toes toward thesion. Action plantar flexion. Description, lowering the foot, pointing the toes away from the shin. Action, aversion. Description, turning outward. Action, inversion. Description, turning inward. Action, protraction. Description, moving a part of the body forward. Action, retraction. Description, moving a part of the body backward. Action, rotation. Description, revolving a bone around its axis. Sprains, strains and dislocation/subluxation. A sprain is a traumatic injury to a joint involving the soft tissue. The soft tissue includes the muscles, ligaments, and tendons. A strain is a lesser injury, usually this is a result of overuse or overstretching. Dislocation is when a bone is completely out of place and subluxation is partially out of joint. The integumentary system, the skin and its accessory organs make up the integumentary system. Integument means covering. The skin covers over an area of 22 square feet, an average adult. It is a complex system of specialized tissues containing glands, nerves and blood vessels. The main function of the skin is to protect the deeper tissues from excessive loss of minerals, heat, and water. It also protects the body from diseases by providing a barrier. The skin is the largest organ of the body and accomplishes its diverse functions with assistance from the hair, nails, and glands. The sebaceous oil glands and the sudoriferous, sweat, glands produce secretions that allow the body to be moisturized or cooled. Nerve fibers help the body adjust to the environment by sensory messages relayed to the brain and spinal cord. Other tissues in the skin maintain body temperature. Nerve fibers also help blood vessels to dilate and sweat gland to produce sweat. There are 3 layers to the skin: the epidermis, the dermis, and the subcutaneous layer. The epidermis is a thin, cellular membrane layer that contains keratin. The dermis is a dense, fibrous, connective tissue that contains collagen. The subcutaneous layer is a thicker and fatter tissue. Hair, nails and glands. Hair fibers are composed of tightly fused meshwork of cells filled with hard protein called keratin. The hair has its roots in the dermis and together with their coverings, is called hair follicles. The main function of the hair is to assist in the regulation of body temperature. It holds heat in when the body is cold by standing on end and holding a layer of air as insulation. Nails cover and protect the dorsal surfaces of the distal bones of the fingers and toes. The part that is visible is the nail body. The nail root is under skin at the base of the nail and the nail bed is the vascular tissue under the nail that appears pink when the blood is oxygenated or blue/purple when it is oxygen deficient. The moon-like white area at the base of the nail is called the lunula. There is also the cuticle at the lower part of the nail and this is sometimes referred to as the eponychium. Sebaceous glands are located in the dermal layer of the skin over the entire body, except for the palms of the hands and soles of the feet. The sebaceous glands secrete an oily substance called sebum. Sebum contains lipids that help lubricate the skin and minimize water loss. It is the overproduction of sebum during puberty that contributes to acne in some people. Sweat glands are tiny, coiled gland found on almost all body surfaces. They are most numerous in the palms and soles of the feet. Coiled sweat glands originate in the dermis and straighten out to extend up through the epidermis. The tiny opening on the surface is a pore. There are two types of sweat glands. Eccrine sweat glands are the most common, and the apocrine sweat glands that secrete an odorless sweat. Anatomy of the eye. There are outer protective layers of the eye known as the sclera, cornea, ciliary body, choroid, and the iris. The sclera is the white outer part of the eye which covers the front of the eye. The cornea covers the front of the eyeball, and deflects light rays as they enter the eye. The choroid prevents the reflection of light within the eyeball. The ligaments of the ciliary body contains the vitreous humor, a transparent, colorless fills the eyeball in front of the retina. The iris is the colored part of the eye. Anatomy of the ear. The ear is divided into three regions which are known as the external ear, the middle ear, and the inner ear. The external region encompasses the outer surface of the tympanic membrane along with the auricle, pinna, external auditory meatus, and the external auditory canal. The middle ear is inclusive of the tympanic membrane and the middle ear cleft. Other structures within this region are the ossicles, along the opening of both the eustachian and the mastoid cavity. The inner ear contains structures such as the bony labyrinth, cochlea, endolymph, and the semicircular canals. Anatomy of the nose. The outer portion of the nose is known as the external meatus, the triangular-shaped projection located in the center of the face. The two chambers of the nose are known as the external nostrils. These chambers are divided by the septum, which consists of bone and cartilage. Other structures of the nose include the nasal passages and the sinuses. Anatomy of the neck. The neck is divided into two large triangles that are separated by the sternocleidomastoid muscle. The triangle located closer to the upper portion of the body is known as the submandibular triangle. This region contains the submandibular gland as well as the hypoglossal nerve. The lower triangle is known as the cervical triangle, which is traversed by the digastric muscle. Other structures of the neck include the carotid arteries, internal jugular vein, the larynx, pharynx, and the thyroid gland. Anatomy of the shoulder. The two main bones of the shoulder are the humerus and the scapula. Four short muscles originate on the scapula and pass around the shoulder where their tendons fuse together to form the rotator cuff, supraspinatus, infraspinatus, teres minor, subscapularis. The end of the scapula, which is known as the genoid, meets the head of the humerus to form a glenohumeral cavity that acts as a flexible ball and socket joint.